Hello, everyone, our Strong Women community. Today I have a treat, a special guest who's gonna interview me so we can talk about my experience on a GLP-1 receptor agonist. Real quick housekeeping, we're in the fourth week of our inaugural muscle building challenge where we laid the foundation to build muscle that will lead us into April. That is actually a get lean challenge. Not for everyone, for people who are looking to lose a little fat, not without having to sacrifice muscle. Muscle on board is a requirement for fat loss because that is what helps us maintain a healthy metabolism. It prevents us from weight regain, it prevents us from injury, and it really supports us through our perimenopausal menopausal journey. So that is an exciting thing we're getting ready for, and it's going to launch on April 6th. And this is my husband Tyler, and we're just going to have a conversation about my experience on a GLP-1, not for weight loss. And just as a reminder, yes, I am a licensed pharmacist. I mostly do health coaching now to support people through a healthy lifestyle, building muscle, learning to build meals sustainably, feeling better, looking better through midlife and beyond. So our interview is just to share my experience. You will have a conversation with your medical provider if you want to determine if starting this medication is appropriate for you or not.
All right, so should I just jump into this?
Yes.
All right, can you explain what a GLP-1 is in plain English? Like, what is it doing for our bodies?
So a GLP-1 stands for glucagon like peptide. It's a hormone that our body normally makes, and it's responsible for helping us basically digest food, shuttling glucose into our tissues. It also is involved in regulating hunger and appetite regulation in the brain. And they developed it in the lab to have a longer half life compared to our natural hormone. And it's been really helpful for people on diabetes. Then they started noticing that it had significant effects on weight loss. Recently, there's really exciting emerging data about having benefits other than glucose improvements and weight loss help. It's been shown to have some cardiovascular benefits, maybe separately from the weight loss benefits, some cognitive benefits, even just even potentially for addiction.
What kind of addiction?
So, smoking, alcohol, food addiction, it really helps to quiet that food noise that a lot of people struggle with, where you're constantly thinking about food. Everybody's a little bit different. Even gambling addiction.
Wow. Why did you personally decide to try this?
So, I had been following the research on GLPs and what they call as microdosing, which is lower dosages that are not typically prescribed for diabetes and weight loss. They had been experimenting with sort of alcohol cravings. And so for me, I had been used to for years my nightly wine as sort of a wind down reward for the end of the day. And I decided many years back that this is not serving me like it used to. And then recently, with the health coaching and just being in the health space, I thought it was a habit that I needed to sort of ditch. It was no longer serving me. However, I found it pretty hard to quiet that 5 o'clock wine craving. And so I decided to try it, to leverage it as a tool to help with sort of that alcohol craving at 5 o'clock, maybe to help me just think less about wanting that glass of wine while I was cooking dinner. And also, I had been getting a lot of questions from patients at the pharmacy or clients or even friends, family who asked me about, hey, what do I know about these GLPs for weight loss? A lot of women are trying to lose weight, and it's been a struggle, especially as we age. And so I figured, you know what? After doing research and figuring that at a low dose it's safe, I'm going to try it. And then I can actually speak from experience and bonus if it actually helps me sort of ditch that nightly wine habit.
Okay. All right. Yeah, I hear about it a lot just from some of my friends also just going on it. Visually seeing people lose weight. I was not aware of those other things. I also heard some controversies, so I
Mm.
know my parents are concerned with some things. But yeah, the that's interesting. And when did you decide to try this?
I started almost 9.5 weeks ago. January 16th is my official first dose.
All right. And what kind of effects have you seen or benefits?
Well, side effect wise, I haven't had side effects. Typically, what we like to counsel people in the pharmacy is about nausea, constipation, rapid weight loss, which includes muscle loss, potentially mood side effects. I haven't had any of that. I did notice within the first 2 weeks that I was full often. I would be sitting down to eat a meal, like say at a golf tournament, like a buffet, and I just couldn't eat as much as normal. I made sure I stayed hydrated, so I never had a problem with constipation. In fact, I was so worried about constipation and hydrating that I hydrated myself so well that in the first this 20 years, and the first time I went to get my blood drawn, the phlebotomist actually told me that my veins were plump, which I always had a problem with dehydration. I digress. So, as far as side effects, they were minimal for me. I was fortunate to be aware of the side effects because of my experience in the pharmacy and counseling patients. And so, and especially because my dose is so low, I take half of the lowest recommended dose of tirzepatide, which is 1.25 milligrams. As far as noticing benefits, there was sort of an evolution over the 9 weeks. So it did not magically remove that alcohol craving. It has helped it a little bit. There is discussion about increasing the dose because I think the dosages that are being studied for reducing cravings and sort of habits and addictions right now are higher than what I'm currently on, but it has sort of improved my relationship with alcohol, feeling less guilty, being able to moderate. And so there's that, which I think goes hand in hand with my sleep quality. I'm hearing from a lot of women, it's typical in perimenopause that you don't sleep well because of temperature changes, hormone changes. So typically, I would wake up in the middle of the night and not be able to fall back asleep. Since being on this, I don't know if it's placebo effect or directly a direct benefit from the medication, but I am able to fall back asleep. A week ago, I noticed I actually remember my dreams. I wasn't dreaming, so I think my sleep quality is higher. I think if you are in this era where you're having trouble sleeping, you can relate. For other people, they it's tricky to relate. I know some people who are lucky that they sleep through the night. I'm not one of them. I've struggled with it for over 20 years. So there's that. And I don't know if this is a coincidence, but I'm noticing that my back pain has improved. I have a chronic lower backache that tends to be flared by sort of lifting, and sometimes it takes me anywhere from 2 to 5 days for that lower back ache to resolve. I'm noticing that my back flare tends to resolve within 24 hours. Again, there are hypothesized anti-inflammatory benefits from the GLP. I don't know if that's directly related to weight loss or if it's independent of weight loss. I like to think that it's independent of weight loss, and so potentially if they can find that the GLP medications are regenerative, indeed it will help people with sort of inflammation and pain in addition to healthy lifestyles. So that's a long-winded answer to your question.
Don't worry, I'm used to that. So,
Mm-hmm.
kind of one of the main things I thought about was, are you concerned that the folks or your clients or whoever follows you from the health coaching aspect will see you as a hypocrite chasing a quick fix and chasing skinny versus I think what you stand for as far as muscle and strength?
Oh, for sure. I am concerned, and I want people to understand that the reason why I chose to take this after doing a bunch of research was just to utilize it as a tool for helping with my alcohol cravings. And then I thought if it could potentially help with my sleep and my back pain and my cognition, that would be a side benefit. I have noticed improvements in the sleep, the cognition, and the pain more so than reduction in cravings. I don't know if that's placebo effect, but yes, there it is tricky to take in enough calories while you're on the drug, and that is how the medication is designed. And so I have lost about 4 pounds that I was not looking to lose. And this is a scale weight. I was not taking it with the intention of losing weight. I've managed to adjust my food intake so that I can hopefully not lose any more weight and potentially continue to gain muscle. But yes, I mean, that's why I wanted to talk about it, just to be transparent, make it clear why I'm taking it, how it's helped me, what I've noticed. I think that's going to be powerful for clients or others who ask me about it, and just that I can speak from experience. I can relate to what they're going through if they decide to take the medication. I can also support them through, building muscle and retaining your muscle, which is tricky to do when you're on this medication. And I really don't think there's adequate education now around build or keeping your muscle and building it while you're on the medication, because that scale weight tends to override that lifestyle and the desire to build muscle, which is not necessarily sexy right now. And but people are going to find out that if they lose too much muscle on this medication, they're going to be in a worse off condition than they originally started. And I feel like it's my job to support women through that.
Okay. So no different than like trying the infrared sauna or cold plunging or maybe creatine as a supplement. GLP
Yeah.
is kind of just
Yeah.
another tool in maybe your belt that an experience that you like to speak from experience
Mm-hmm.
and try it.
It's definitely always going to be lifestyle first.
Yeah.
And lifestyle is going to be the biggest needle mover. So how you're taking in nutrients, the appropriate amount of calories, not too much, not too little, your strength training, your sleep, your mood, relationships, all of that. And then you can start to layer on sort of the sauna, cold plunge, maybe low dose GLP,
Fasting.
supplements,
Yeah.
right? Yeah.
Okay. You mentioned scale weight because some friends and family that maybe have seen you in the last few weeks also say you look a little skinnier. So there is visually some difference. I don't see it as much because I see you every day, I guess. But that has been. Are there's things that you're monitoring, or you
Yeah.
feel like anyone on this should be monitoring?
I wish that I started off taking body part measurements, not so much to measure because I want to be smaller, but to measure like my muscle, my glutes. So that is what I would recommend for somebody starting this journey, is having a bunch of baseline data points to measure, like body part measurements, your energy levels, your absolute strength. So for me, and I'm also tracking and logging your food and your calories to make sure you hit your protein goals. But right now I'm monitoring scale weight. I'm sort of loosely monitoring my clothing fit. And then I use my absolute strength, sort of just the number of pull-ups that I can do. I started off being able to do about 9 or 10 pull-ups on a really good day, and now I'm able to do maybe 7 or 8. So I worry that I lost a little bit of muscle and a little bit of strength. I haven't been the greatest about tracking, and so that is something I'm going to start to tighten up on, and I would recommend that for others. Just energy levels, I've noticed that just sort of my subjective energy levels took a dip for a while over the past maybe at week 3 to 6, I noticed my energy levels were lower heading into my workouts. It was harder to start my workouts because the friction felt high. And I'm attributing that to just a unintentional lower calorie intake. Since I've increased my calories and my healthy fats over the past week, I feel definitely more energized going into my workouts, during my workouts. And I am confident I can get back up to my 9 pull-ups.
Okay. Something came to mind when you were talking about the nutrition. So I guess this GLP-1 is supposed to suppress some of your appetite or cravings.
Mm-hmm.
I hear you talking about nutrition a lot
Mm-hmm.
with your clients and protein goals. Have you been able to still maintain protein goals? Is it just overall caloric intake, or have you been struggling to even hit kind of those required or what you feel is required
I
protein
can
goals?
easily hit my protein goals because I was getting really good at hitting my 35 to 45 grams of protein per meal without taking in extra calories. And I sort of kept that within my GLP journey, and I had to reverse it so that instead of trying to take in high protein with sort of calorie sparse foods like veggies, I've shifted because I don't want to lose any more muscle or weight to keeping my protein the same. So like lean meats, a lot of lean dairy products, high protein plants like edamame, tofu. And I think I unintentionally was taking in less carbs and less healthy fats, which I always limited, just as far as not taking in too much calories and sort of setting the example for people that I'm working with. So I think that unintentionally my intake lessened. So recently, the past 2 weeks, I've had to increase some of my carbs and my healthy fats. So a little bit more peanut butter, a little bit more whole milk, a little bit more bread, which I sort of limited in the past. But
Okay.
I'm able to hit my protein goals,
Protein
no
side.
problem. That's a habit that I can say I'm solid in.
Okay. Is this over the counter or do you need a prescription?
So you need a prescription. The GLP market is sort of the wild, wild west right now. There's ways that you can get it without a prescription. I would recommend responsible use in addition to lifestyle and building muscle is you see a licensed provider and they are going to be able to determine whether you get one of these FDA approved products, Ozempic, Wegovy, Mounjaro, Zepbound, or they do have compounded versions that if you're going to a reputable, legitimate place, is also going to require a prescription. And these are non FDA approved versions. So you're going to have to do your due diligence and research about making sure you're going with a safe, pure, compounded version. And that's where a licensed medical provider and a licensed pharmacy is going to be your best bet.
Compounding, you mean like they're mixing it with other things so that for added benefits, or
Yeah, no, they're just actually taking the raw chemical active ingredient and they are able to make it in the pharmacy.
mm,
And it's not subject to the rigorous FDA sort of phased trials and testing.
okay, got it. What I guess maybe someone will be interested in the cost or if this is covered by insurance.
Yeah, I haven't seen it covered yet for weight loss. As far as the products in the pharmacy, it is going to be covered by insurance if typically if you're taking it as a diabetes medication. For weight loss, I haven't, it's rare to have insurance cover it. So if you're taking a FDA approved version like the brand names Ozempic, Wegovy, Zepbound, you're going to be paying, I think it's $800, $900 per 1 month supply until they come out with a generic. As far as the compounded versions that you're getting from a pharmacy, that's on a different pricing tier. I've seen anywhere from $50 to $100 a dose. Usually the price is reflective of the dose that you're on.
Okay.
So you're looking at anywhere from like $120 a month to 140. It depends on your dose.
And how long does someone, well, how long do you plan on doing this?
I think I'm gonna give it another month, and really, because 2 months might be, in my opinion, or just when I speak with my provider, maybe not long enough to sort of help with sort of that neuroplasticity and rewiring the brain as far as like the dopamine reward cycle that's involved with cravings and addiction. So I'm going to give it at least 3 months, and I'm going to just keep evaluating every month. And it's sort of been like a challenge for me. I'm taking on as like a self fun challenge to see if I can actually increase my strength and build muscle. So, not just playing defense to not lose muscle, but also building muscle while I'm on this low dose medication. So, that's going to be exciting. I'll keep you posted.
So, like any big lesson learned, or what you can walk away from this that is beneficial maybe for your clients or others?
The first thing that comes to mind is the muscle. I think a lot of people are just enamored or mesmerized by being able to take this medication and just not having to suffer through like grueling workouts or hunger to try and lose the weight. But I am seeing people who are skipping meals and just not taking in enough calories, and I just feel like I think the word's getting out that whoever's prescribing these things just needs to really not scare folks, but just warn folks that this medication needs, like anything, needs to be taken responsibly. And if a goal scale weight is going to be quickly, the joy of that is going to be quickly outlived when you are sore and sort of weak. It doesn't help reduce hospitalization or injury risk. And so, and understanding how tricky it is being someone who's on half of the lowest dose to keep my energy levels, my calorie intake, and my muscle and my strength high. I think it puts me in a good position to be able to relate to others. Sometimes once you sort of have your health running on autopilot and your healthy habits, it's really hard to relate to your clients or your patients and just the struggle. And I sort of like that this helped me just to be able to relate, and it puts me in a good position not to tell people what to do as like a healthcare provider or health coach, but just to partner with them. So it wasn't a big aha, but sort of my philosophy right now.
Alright. Yeah, it does sound more complex. I mean, if someone's goal maybe to just lose weight, it'll be effective, but it may not be the best way to lose that weight. It sounds like you should be monitoring a few things, which isn't a cookie cutter, and everyone's situation is different. So,
There's always a sacrifice for quick fixes. And as humans, myself included, we like quick fixes. We like to take a magic pill. We like to go for a one time aggressive skin treatment, surgery. I can relate to all of those. But yeah, it's that quick fix, shiny thing that humans are just like drawn to. And but there's always a sacrifice. Life sounds boring, but it works.
that was my all the initial questions I had. I know this is very vulnerable, and you're talking about maybe some vulnerable things, but I think it was good to get some information out. I like that you are willing to try it in a safe way so that you can share the experience with others and potentially help others on this journey as well.
Yeah, I hope this is helpful, and I hope that if people have questions, they come to me. If you know me even half well, I'm very transparent, almost too much so, and that's just because of how I want people to be with me, and I've always been that way. And shoot me a email or a message if you have any questions. if I don't have the answer, I would love to help you figure it out.
All right.
Thank you. See you next time.